Drew Sutton Leadership Show, lighting the way with real leaders, real stories, and real impacts. Because when leaders stop growing, the darkness wins. All right, welcome to another amazing episode of the Drew Sutton Leadership Show. Today's guest, Brie Cox. Brie goes from dancing at the American Ballet Theater to directing USDA-backed food equity programs. Brie Cox moves systems with purpose. She's a strategist, restaurateur, and policy whisperer, advising on food insecurity, rural health, and social impact capital. Whether it's healing communities or running Latin restaurants, Brie does it with grit, grace, and serious game. So without further ado, welcome to the show, Brie.
Hi, Drew. Good morning. Thanks for having me.
Yeah. I'm super excited to have you on the show. As you know, I'm doing a brand new venture called Jubilee Capital, where we're raising a venture capital fund here in Kentucky for social impact, for impact investing. Very excited about that. And so Serenity Wright is the one that connected us. And we had a great conversation, I think about 2 weeks ago. And immediately I said, Brie's got to be on the show. So before we jump into that, you are a ballerina, but not just a ballerina. The American Ballet Theater, I think it was started in 1939. That's kind of like the Broadway. That's like the Harvard of ballerina-ing. How did you get into that?
So I started doing ballet when I was 2 years old. And by the age of 10, I knew that that was what I wanted to do with my life. I have had the wonderful fortune of dancing all over the country. I have a Bachelor of Fine Arts degree in ballet performance from Texas Christian University. That took me to the Kennedy Center and also kind of vaulted me to American Ballet Theater in New York City. And then I also, by way of New York, moved to Kentucky for my job with Kentucky Ballet Theater, where I was in the company for 6.5 years and then the executive director for 4.
That's awesome. All right. So you go from dancing to leading food insecurity and food equity programs. There's got to be a jump in the middle there. What jumps from ballet to food insecurity?
Yes. So while I was dancing professionally, I was looking to get off my feet and get out of working in restaurants, which is still happening. And I ended up to kind of start a small marketing agency back when social media content was the new hot thing in the 2010s. So I had a small book of business. And when I left the ballet world in 2018, I joined a digital marketing firm here in Lexington that focused on healthcare advertising, marketing, branding, all of that. So that was 2018. And then in 2020, COVID happened. And working in a healthcare focused digital agency during COVID was a wild ride. I worked with 35 different hospitals across the Southeastern United States on everything from COVID communication to continuing to tell people it was okay to come to the hospital. So really kind of dug in there. And then in 2021, I started a consulting contract with App Harvest. That's a very interesting venture startup story unto its own, and realized that I was much more passionate about innovation at the intersection of healthcare, agriculture, and technology, and bounced out of digital ad land after slugging through the pandemic and advertising over into what I call social innovation work today. That is really strategic partnerships and rural health and place-based solutions.
Love that. So let's talk about social innovation. So I think we all understand what innovation is. We have a problem and we have a new solution to that problem, right? So I think we're good there. But social innovation, those are two very big words, social and innovation, that can lead to a conflict of, well, am I just doing nonprofit work that's not innovative, or am I doing innovation that's not particularly impactful? How do you balance that?
So for me, I would describe social innovation as encounters, interventions, or interactions that integrate industry systems and then configure a component of an industry that make it for healthcare non-clinical. It becomes social and community. And in agriculture, it's not working in the fields. It's more of selling, marketing, selling your products and having go-to-market strategies. So for me, it's those one-to-one engagements where we bring industries outside of their comfort zone in that innovative capacity, and we use the social structures of the community around them to really help them soar. And that is where you see so much wonderful community benefit.
I love this. I'm actually a pretty big nerd, as most of my audience knows. I started reading The Wealth of Nations, which is like this huge, like old school book back in, it was Adam Smith, The Wealth of Nations. He's kind of like the father of modern economics. And one of the things that he says is, when you're a farmer and you have, you're making good money on your beef or whatever, oftentimes you neglect the effort of transporting that beef to market and then the time standing in the stall to sell that beef. And so a lot of times you're not accounting for the margins or the profit that you're not making there. So bringing in people to help with that is really critical for the environment. One more quick story on that. This is a family story for me. My wife's grandma was the first tobacco warehouse owner in Lexington. So back in the early 70s, she and her best friend, they kept books for folks, and then they bought the warehouse, and so then it was their job to sell the tobacco, which was a huge industry here in Kentucky. How can we, as citizens, as industry leaders, how can we help the local farmer and to help that ecosystem stay strong?
You have to participate, right? There are so many wonderful community-based organizations across the Commonwealth and the Central Appalachian region that it's one thing to see a poster on social media, it's another to go. It's another to take a friend with you. It's another to take your child. The ability to interact and really be public and present and show up is something that large institutions have because they have human capital. Now, going to a farmer's market when it's at a hospital, we've just checked all those boxes. And that is, for me, one of the best applications and physical examples of social innovation. I was with the West Virginia Department of Ag a few weeks ago, and their farmer's market president said out loud, farmers markets are supposed to be expensive. You are taking care of your neighbors and you are supporting their local business. So I think when we come out of those traditional industry norms and we look at it from, we're all small business owners, we are all trying to have a healthier life, we are all trying to navigate this crazy post-COVID pandemic world together, that's where we really see community vitality, spirit, and then the resilience that we're also well known for.
Yeah, and I think this kind of goes into your comment about fueling the food system. Am I right?
Yeah.
One of the metrics that breaks my heart, and actually I feel the tension personally, is that when Walmart comes into a community, on average, the community revenue goes down by 10%. And I think that's because when we are supporting the farmer's market and we're supporting the local ice cream shop and we're buying, we're getting our car fixed at the local mechanic shop, our dollars rotate, I think, 7 times within the community before it leaves. But when you bring somebody large in, that changes the dynamic. Talk to us about fueling the food system and kind of how we can help with that.
Yes. So I'm glad that we're starting with this because food is medicine is something I'm very passionate about and where I spend a lot of my time working. And that's only as good as taking care of the people that fuel the inputs. So with the Kentucky Department of Ag, with Commissioner Jonathan Schell and the Appalachian Regional Healthcare System CEO, Holly Harris, we have built the Farmer Care Initiative. We have taken traditional healthcare out into the community to the farm gate. We can't expect our farmers to have excellent outputs if they're not healthy. And we know that mental health and cardiovascular disease and smoking and diabetes are rampant, not just here, but everywhere. There's actually a division of the Kentucky Department of Agriculture called Raising Hope, and that's run by Dale Dobson. And that is purely built around farm safety and rural health. Bringing rural health into agriculture is a no-brainer to me today, but having folks understand that they can go to their local extension office for their plant pickup or to get guidance on how to manage their livestock, and then there's a mobile clinic or a screen team there or a hearing test that's happening, that is how we ensure that small family farms stay operational and that we continue to have good economic development in these communities. So it's so much more than just one farmer in one community or one doctor seeing patients all day. Blending those systems and making sure that we are protecting those that fuel the systems that we are working so hard to uplift is incredibly important. And I think that in the food is medicine conversation has been lost a little bit because we're so focused on health outcomes. Well, we can't address the health outcomes if we don't go upstream to deal with how we get that food.
Yes, and I think when you're hitting on innovation, right? Innovation is removing that friction from the stuff that we all know we need to do so that it just naturally is available. Like the energy to make it happen is way lower. And I think that's where things start to flow smoother. Do you have any favorite stories about fueling the food system? Because I know that you've done work, like you said, 35 hospitals, how many, like multiple states, about like how many states are you working with right now?
Right now, I'm focused on what I call my core four, and that is Kentucky, West Virginia, Tennessee, and Virginia. I will share a story from a grant that I just finished in Virginia a couple of weeks ago. This was a food as medicine pilot program for population health focused on nutrition education. And there was a children's produce market with the Virginia Extension Service. And we brought a produce prescription dietitian nutrition class to complement that, to be an opportunity for the adults to have something to do while the children were shopping at the market with beautiful, fresh Virginia produce. I have a dietitian on my team, and because of the style of event, she actually did probably 50 one-to-one dietitian consults in 90 minutes. And in doing that, some were short, some were longer, but there was one woman who was a farmer who lived in a very remote area. They are subsistence in their lifestyle. She has a son who has been very, very sick, and no doctor can figure it out. Talking about blood work, going through all of these, what it could be, what it couldn't be, just and then talking about food. And the dietitian, who's a very good friend of mine, had such a wonderful impact on this woman that 2 weeks later, when we had our culinary medicine cooking demonstration class, this woman drove 90 minutes round trip to bring me 24 farm fresh eggs from her farm. She said, "What I learned from you and your team have already made such a difference. I know I know you love fresh eggs. I would love for you to have these." I'll never see this woman again in my life. But that was so incredibly impactful for me in that moment, that one-to-one engagement where it's something for a family, where it's focused on agriculture, but we bring the healthcare complement to the table is absolutely amazing. Another one that is super quick, at the Kentucky State Fair, we had built a large partnership with Raising Hope and part of our Farmer Care initiative. And we had the Appalachian Regional Healthcare Diabetes educator on site doing A1C testing. Totally free, no cost, part of one of the exhibits at a very high traffic zone. We had a family with twins who had a distant family member with type 1 diabetes. The children had their fingers pricked, and both of them came back as diabetic. So the mother, while distraught, was like, "I'm calling our pediatrician right now. It's a Saturday afternoon. Thank you." To
Yeah,
catch juvenile diabetes that early, even with a distant family relative with that incidence, is crazy. And they had not had that tested. So that's another great example of social innovation that's a little bit more clinical in its delivery. But it was because we made those opportunities available in a place-based community system that we were really able to positively impact lives.
I love it. I love it. So, and you kind of, and you mentioned this with the lady that had the eggs. Nutrition is a big piece of this. My sister is a nurse practitioner out in West Tennessee, and she's just started her own practice where she does more holistic medicine. So she still does the traditional medicine work as a practitioner, but she coaches people on their diet. She coaches people on their health. She wants to prevent people from getting on medicine instead of dosing them up once they're on it. So let's talk food as medicine. Is this Christian Science where we should never go to the doctor and we should just eat right? Is this what does food as medicine mean?
So, food is medicine is a very large movement nationally right now, but it is the ability to use food in place of or to correct chronic disease. Generally, clinically, food is medicine would be at reversing type 2 diabetes, cardiovascular disease, and hypertension. That's on the very clinical tip of the spear. If we go downstream, down the chain, food as medicine as a population health solution is a way to stress prevention and address food insecurity. You can be
Mm,
food secure but metabolically unwell. You can be
yeah.
food secure and nutritionally insecure. So this is about making the right selections of foods to make sure that you don't have a sugar crash, that you don't develop diabetes. I believe in all of my work that it is actually a better approach to look at this from the population health side versus chronic disease management, because those patients are already on medication. They are costing the system the most money, and interventions for behavior change are some of the hardest to make and sustain. So when we go back down and we look at having farmers markets and nutrition education classes, and really using local food as a primary health intervention from a policy perspective, that is my thesis. And we are getting so much traction across the central Appalachian region, but also nationally. So it's bidirectional. But it also is a way to make people conscious about what they're eating. Ultra processed foods are a tough place to be right now because they're chock full of food dyes and they are made in warehouses. I mean, there's so much. So we are simply trying to move the needle on people making a local, a fresh, a better, healthier choice for all the right reasons versus it's going to hit the dopamine in your brain that says, "Ooh, that sugar is really great. Give me three more."
Yeah. Well, as long as we're not talking about cinnamon toast crunch, I think I'm with you. That's my personal poison. I love cinnamon toast crunch. Like the kids will buy it at the grocery store, and I have to remind myself, like, don't eat the whole box. Let them. This is their cereal. Um, my kids, I have 4 kids, and I've decided that they like to eat the color brown. They like chicken nuggets. They like cheddar cheese. They like cinnamon toast crunch. Um, but just kind of guilting parents into forcing their kids to eat better, I don't think that that's the solution. I think that's part of the solution, but that's not the solution. What are our centers of leverage that where we can really start getting people's minds to change and habits to change?
So when you first asked me, like, what can people do? And I said participate, this
Yeah.
is exactly that. This is shopping around the external of the grocery store, part one. It
Ooh, I
is
like that.
taking your kids to the farmer's market on Saturday morning and educating them. It's about preparing meals together at home. We firmly believe, from the healthcare delivery side of things, that if we can get into the household with children, we can create generational transformation in the household.
Mhm.
So, the Kentucky Department of Ag just had their All In for Ag Week, and we are looking to add nutrition education into that, into some component. There's great work being done with pediatric practices and family practices. Lifestyle medicine is really coming onto the scene, and the system that I advise will be the first healthcare organization in the state of Kentucky to have a full service line that has a dedicated segment of its practice to nutrition counseling. So we have to get the kids interested in eating healthier, bright, colorful, the ability to, grow it in the ground. People used to garden. I mean, Kentucky is an ag
Mhm.
state, and having family gardens and doing that. I mean, I grew herbs. I'm from St. Louis, Missouri, but I had grown herbs as a kid in the window. Giving them, having them take ownership of the food that they are consuming really has the ability to change the game. The last thing I'll say here is that, children are the next generation. There is, in Kentucky and West Virginia right now, we have the highest number of students enrolled in FFA ever.
Oh,
That
yeah?
is so much leverage and offers so much capacity. When those children, students, young adults continue, price is obviously going to be, it's going to matter. But if we can instill some of these really good habits early, or if you have healthy food, healthy snacks at soccer games, it is so basic. And these small little one-to-one interventions that make a difference. A quick story here: as a ballerina, we all teach. I got charged one summer with teaching nutrition for dancers, and I have a parent that I can still remember calling me and saying, "I don't. You broke my daughter. She will only eat bananas and wants chia seeds. She used to only eat chicken nuggets." So I would say, as a dance educator, eating for energy is really important, and that's
Yeah.
going to be so much better than an ultra processed food that's going to send you up and then crash you
Yeah, I can tell you that person. So I'm 42 now, and in my 20s, I could just eat whatever I wanted to eat, right? And maybe after like a week of terrible eating, I'd feel something. But like as in my 40s now, I'm like, oh, I should eat better because I can literally feel my body energy rising and dropping. Convincing my fifth grade daughter to do that is a little bit more of a stretch. But I loved you mentioned FFA. FFA is all time favorite program for me. It A lot of my friends were in FFA in high school, and they it's just such a great leadership program, and it gives them such pride in the stuff that they do. That being a farmer is a honorable profession. I think that we talk about, oh, you want to be a coder, you want to be this, you want to be that. Farmers have a lot of science that they have to learn. They have a lot of process, like all the stuff you have to know as a farmer to run a successful farm is actually quite remarkable. How can we inspire more folks to get into farming and even if just starting a garden, maybe just starting a garden. What's your thoughts on how to get folks in the ground more often?
that's a toughie. I mean, I think FFA is one of our best solutions. I'm going to speak to this from the healthcare side as well, because
Yeah.
interestingly, healthcare professions and agricultural professions have a lot of process and a lot of science, and I think that we have to blend those two together. So, in East Kentucky, there is an EDA grant running right now through SOAR, Shaping Our Appalachian Region, about creating 90 pathway placements a year for 3 years for high school students to go right into the allied health professions. I would love to see something like that happen for agriculture. We probably would need West Kentucky, where there's much larger farms and production ag
Yep.
scale. But so one of the projects I'm working on right now is how do we get FFA kids excited for their future in ag? I think that people need to understand the business side, but they also, showing up for them and having some energy and around what they're doing right now and letting it be seen that it is a viable path. I mean, I was a ballerina. 0.1% of people who ever do that will ever do what I did. And I don't say that because I am conceited. I say that because it's a reality of how difficult the industry is. We can all do hard things. The grit and resilience that you're going to see in healthcare providers and in some of these high performance athletes, the farmers have some of the same things. And what is very important right now at the national and federal level is that people in the agricultural industry stay in the agriculture industry and don't feel they have to go get another job or have to do something else to make ends meet. And that's that's a place where there's going to be guidance coming down soon on how that can be supported more intentionally. So I hope that answers your question. But the All In for Ag Week in Kentucky has been now 2 times they've done it, has been a great example of that. And then, leveraging the power of those FFA students, but also families participating in social activities that drive agricultural opportunity, and also by the same token, healthcare. Those pathway programs, apprenticeships in Kentucky are a really big deal. They're going to eliminate collegiate debt. They are a great way to have high paying quality jobs that can be applied to any part of the country for a long-term career. So I would put those two together, actually. And I think that that's, again, an integrated industry approach that most people wouldn't take, but it's absolutely appropriate for what we are trying to do.
Yeah. So, all right, let's talk leadership here. This is the Drew Sutton Leadership Show. All right, so let's say that I'm a leader of a Fortune 100, 500, 1,000 company, maybe a large, like a medium-sized company here in Kentucky, which is kind of a larger. How can I, as the CEO of a company, start improving the health of my team? We can say that it's for saving healthcare costs. Like if you need a financial reason, like I think we all know that if our people are healthier, they're going to work more, they're going to be more energized, they're going to be more excited to come to work. But how can I, as a leader, really start making a dent in this health crisis that we have running rampant in America?
So there are a couple of points here, and I'm going to use ARH, the healthcare system that I have the fortune of advising, as this. When they had a new leader, Holly came in 2021, she established a new culture and said, we are going to go back to the basics, and we are going to have a culture of health, hope, health, and healing. And that,
health and healing.
Yes, and we go back to that constantly. But if the company has a strategic plan or they have strategic priorities, that becomes where you start. Now, a rural healthcare system is its community, and with almost 7,000 employees, how can we preach better health outcomes, eating better, if we're not taking it into the workforce? So there are so many different kinds of workforce programs that can be deployed. ARH has a mobile clinic, and they are taking that mobile clinic to employers to screen their employees while they're there. Oh, I don't have time to go to the doctor. Okay, we can check that box. We can fix that. Removing soda machines from offices. Check that box. Revolt will happen. They'll get over it.
You're picking a fight now.
Yeah. Well, and then also overhauling food service. And that's something that, again, it seems really basic, but to highlight a local farmer who has tomatoes on a burger or something like that gets really powerful. The food service thing is a much longer term play. It takes a lot more time, but it is where you see that sustained impact.
So
and then
let me jump in there real quick. I got the opportunity to interview at this company. I think it was AeroVironment. I'm pretty sure this is the company I'm thinking of. And so I'm there for a full day interview. We're doing whatever. But at lunch, I go down to their cafeteria, and they don't have food. They don't have a cafeteria there. They just have like a stall where a local vendor comes in, and then all of their employees can pay $5. And this is in semi-recent history. So like $5 is an absurdly low price for lunch. But you pay $5, and so clearly the company subsidizes the other $15. But then on the tray, on the lunch tray, there was graph paper with the company logo. So they were encouraging them, hey, don't go out for lunch. Stay here, get cheap, good food, and dream with your buddies at the table. So like now they're doing work when they're not at work, and they're super happy because it's $5 instead of $15 or $20. and they're staying on campus, communicating with their friends in the most creative time that they have at lunch. So just a note to the CEOs out there, listen, there's ways like food can be one of the most value add things that happens instead of a cost center.
And there are two other things I want to come back to on that. I would also advise, and any large-ish organization, probably more than 50 to 100 employees, is going to have HR. Well, HR is only one part of the puzzle. You need to have a dedicated and benefits and wellness program coordinator. ARH does this really well. And in doing that, they have been able to set up employee CSA boxes that the organization subsidizes. So let's say it's $40 per box. The system pays $20, and then the rest comes out of the paycheck for $20, and the boxes are delivered to the hospitals. The second part of that is the most beautiful to me is the local farmers come with their boxes and then tour and meet with the nurses and those who are taking home their commodities. I love that. The other part of that is farmers market vouchers subsidized by the employers. $10. We did this in Hazard, Kentucky a couple of weeks ago. The number of nurses and staff that came out at 4:30 on a Friday to get fresh vegetables and fruit to take home with them for the weekend. Meeting people where they are in the social innovation space makes everything sound so simple, but to build the infrastructure to get to that point takes time, and it takes vision and commitment. And 5 years ago, when I started talking about this, people thought I was completely nuts. But a dedicated benefits and wellness person that focuses on the community activities that can support the workforce goes beyond just their health. It is also social, it is also economic, and it is really brings them more into that community.
So I'm gonna kind of change kind of what you said there, maybe, and that is good leadership. Hey, Mr. CEO, Miss CEO, good leadership is about finding somebody like Brie who knows what they're doing so that you can bypass 5 years and you can jump straight into the things that really change your employees' lives. Man, when I teach leaders, I do corporate leadership talks and that type of thing. I remind everybody, as a leader, you're a Tyrannosaurus. That means you got little tiny arms and you got a really big mouth. And your job is to say the words to encourage your people to do what they wanted to do anyway. They just didn't know if they had the permission to do it or they needed the encouragement to do it. You have little tiny arms. You can't do a whole lot, but you can say a whole lot that will really move the needle. So getting that benefits person involved. And if you don't know how to do that, Brie, I think might have a couple of pointers there.
Well, so I would say on that, I mean, I have had the fortune of walking this journey with a healthcare institution, with different agricultural organizations. I love the ability to lean in and help them dream really big. CEOs fight fires every day. That's what they do. And so to be able to lean in and say, like, let's dream big, let's take a step back. How do you want to see this? I pride myself in the way that I work on being energy, time, and capacity. Because when you put those things and you put it, I am nimble enough in my operational style that I can run between departments or institutions to be able to blend all of this and put it together. So you have some sort of a community event. Yes, energy, time, and capacity. And people think I drink like 18 cups of coffee. I only have one a day. I am just so inspired by what I see and all of these little wonderful success stories that are happening. But as long as the senior leaders can articulate their vision and they have a willingness from the bottom up as well to participate, then we can really make some magic happen. And being nimble and running between and making sure that departments in large organizations are talking to each other, breaking down the silos, that becomes a really important way of making all of this fit together. And then on the external affairs side, with large format institutional partnerships, being able to run between leaders who respect each other, who trust you, makes it that much better. This partnership between ARH and the Kentucky Department of Ag has been magnificent, mostly because the organizations are mission aligned and they care for they support the same populations across the Commonwealth of Kentucky. Yes.
Yeah. So I think what we're getting into here is community-based system design. So the most healthy things for us aren't just going to happen. I know that in my house, if I don't force the family to clean up and do their laundry and do the dishes, that it can kind of pile up, right? We can clean it for the friends. Actually, sometimes we invite people over just so we'll be forced to clean the house. I don't know if anybody else does this. But then that's a Saturday, then Sunday, all of a sudden the house is a mess unless the leader is pushing a system forward that is sustainable. So how can we, as leaders, as CEOs, as middle managers, just as community leaders, how can we start really pushing forward a system that works? Do we need a plan? Do we need, or can we just do small things right now?
So I would say the way I've had the most success with this. First, there's room in the pool for everybody. There's enough
Mm,
space and enough need that every organization can address their core competency and be a contributing community organization. Quite often, large organizations get tagged with, well, you can do all these things for us and we'll just show up. That's really unfair. And it also pulls them away from their core mission and their core business delivery mechanism. So, for me, from a community based system design, I want to line up the partners and let them tell me how they are willing to engage and then build the event or the organization or the framework around it. And I just finished this grant in Virginia for population health food as medicine pilots. We did 6 pilots in 7 weeks with 8 community partner organizations, all of whom brought something different to the table, maybe from a different industry, maybe a couple more heavy on the health side, but one is cancer prevention, one is primary care, one's a local department of health. We do not need to be exclusionary in any capacity, especially in rural communities, because these people are our neighbors and our friends.
mm.
And so, really, as long as there is one organization that is willing to take on the coordination of that, and that's for me as a consultant, that is what's been so powerful. I had a wonderful career on stage for a very long time and got to say everything I wanted to. So now I have the beautiful ability to be in the background and wind up these teams, inspire and empower them to push them into these next activities together. And the goal is to spin the plate, kind of like take your hands off the clay wheel that's spinning, pull back and let it run. Because what I learned during advertising during COVID for healthcare, if you are the singular person, you're dead in the water because it is all on your back. And that is
Yeah,
a
yes.
different kind of stress. But to be able to set it up and empower your clients to take ownership of it, or even your partners to feel confident that they can walk in or they can call you and they can ask for support, I call that peopling. And that's part of what I love to do. But there's social innovation embedded in that as well. And Dr. Serenity Wright and I had the wonderful privilege of writing a very large NSF grant that we did not receive, but it was all about actually making health impact with community based systems design. And people said we couldn't do it. And now, a couple of years later, we are starting to see improved health outcomes by some of these tactics in raw data.
So yeah, I want to jump on this a little bit. This is what Serenity it so amazes me at, and then you by extension, we're getting to know each other still, but Serenity does what I call the white or the manila envelope. So my mentor in helicopter design, this back in the early 80s, he and another partner said, if we want to make this new type of helicopter, what sort of things do we need to get done? And so on the back of this manila envelope, they just sketched out the whole process. They're like, well, we would need to do this first, then we need to do this. And they said, we don't have any money for this, but this is what we need to do. And over the course of the next decade, they got every one of those things accomplished. And he still has the manila envelope. It's on his wall. And this is for Bell Helicopter. And so the V-22 is the aircraft that like kind of moves things like that. As a young man, he partnered with another friend and they just wrote this thing down. And then gradually, sometimes they got rejected, but they just kept pounding on it. And then all of a sudden there's a brand new technology in the world. And this is what you two have done is you wrote a grant for NSF, but you didn't let that glitch stop you. And now you're starting to see traction as the message keeps going. Anyway, it's super exciting. This is why I love the social innovation side is I think you called it peopling. We get to be people. And we're giving each other excuses to be the good people that we wanted to be to begin with. But maybe we didn't feel empowered to, or maybe we were confused by. We are starting to run out of some time. So I'm just going to give you the floor for the next 2 or 3 minutes. Tell the audience how we can do better managing food as medicine, fueling the food system, and being a part of community-based system design.
So I think all of those 3 things all tuck really beautifully into something that my friends and I talk about as rural prosperity. And I'm very passionate about what the rural prosperity space can be. We need to look at the industry systems around us, healthcare, agriculture, education. All of those need to operate at the best of their capacity for us to have viable, sustainable economics and across regions. Healthcare is foundational. People tune out healthcare because they think it's a silo and it's complicated. It is. But healthcare is economic development. Agriculture is economic development. We have to look at these things in a much broader lens and think about the people that make them go, but also what human capital, place-based assets, farmers markets, pavilions, hospital campuses? What do we have that can serve as an assembly point? Because we are only as good as our weakest link. Obviously, education has been under fire and is continuing to evolve every day. That's a system I haven't cracked the nut on yet, so more to come. But I firmly believe that by blending the intersection of healthcare and agriculture, we can address rural health access, food insecurity, metabolic disease, future careers in rural areas that are generational, that do pay well, that are not going to stretch families beyond what they're able to do. And that also, it's really important that maybe we don't need big, shiny grants. Maybe we need to just do the work. And it's in Appalachia, people come in, they drop a bunch of money and they leave. And the communities have become distrusting of that. So I love being in market. I love being in the field. That gives me some of the additional reminder that I need to keep going when things get really hard. I also really don't like the answer no. So I'm willing to get creative and put in the extra work and go the extra mile to make sure that all of these things can happen, even if it puts me in a pinch because it's the right thing to do. So I just finished an 88-page grant report for this program in Virginia, and there are hospitals that have lined up and asked, how can we do this? We want this now in our communities. That's the goal. If we can have these pilot to scale models where we start with an individual critical access hospital, and then we take it to a whole healthcare system, and then we're involving state departments in various capacities, at that point, we have satisfied the continuum. Food as medicine is only as good as the agricultural inputs that make it possible. So the population health side of things, as I will continue to preach, I am not a clinician. I am not going to be able to diagnose you with food and diagnose you with a disease and tell you how to deal with it. I would be much better served to direct you to the resources, whether it is a medically tailored meal study or some nutrition education that is happening at your local hospital, at your local extension office, as a means to build support and community around that. Diabetes education in this country has made great progress and moved the needle in that capacity. And I firmly believe that, yes, a healthy workforce matters. Yes, a healthy economy matters. But we have to go back to the basics of health, hope, and healing to make sure that rural prosperity can stay intact so that these beautiful generational families who lived and worked on land for hundreds of years can continue to do that, because this is from the region that built America, and it is the region that has kind of been forgotten. And so I am way too passionate and way too excited about all of this all the time, but it infuses this sense of ownership and excitement into these large organizations to help them believe in themselves. And in so doing, they take that home, and then it explodes in their local communities for additional prosperity.
Yeah. Well, listen, if you're listening right now and you're a leader, either whether that's in the state government, maybe at a university government, maybe in a hospital, or at like a Fortune 500, Fortune 1000 company, if you have a lot of employees and you're looking a way for them to be more healthy, and you're looking for a way to help lead them into the community that you want to be a part of, Brie has some amazing ideas that you should follow. If you want to get a hold of her, she's at coxconsults.com. She can come in and help you think through innovative business benefits that you can put together. She can help you think about ways to connect with your local healthcare providers. I absolutely love the farmers market vouchers, or the CSA, where you bring local farmers in and you make that part of your food plan for your employees. There's lots of ways that you can make a big difference, not just from an economic perspective, but from a community perspective. As leaders, that's our job, is to lead people into a better place to be. So reach out to Brie Cox at coxconsults.com. Tell her you saw her on the Drew Sutton Leadership Show. With that, we are out.